As I said last week, we are seeing escalating COVID-19 numbers in countries all over the world. Far from coming to an end, this pandemic continues to escalate at this point. Increasingly, the main variant that we're dealing with around the world is the Delta variant. This variant is more transmissible, it's causing more hospitalisations, it is causing more people to die, and it's making younger people sick. We're seeing it wreak havoc, and that's why the government's been doing a lot of work to plan for the possibility that COVID-19 could once again make its way into the New Zealand community. Part of that work has been asking Sir David Skegg and the Strategic COVID-19 Public Health Advisory Group to look at how New Zealand might reconnect with the world while maintaining our elimination strategy and keeping New Zealanders safe. We welcome that report and its suggestions. I know many of you will have questions on that, and we will answer those tomorrow. New Zealand's got a robust contact tracing system, and we're seeing it in action, and it served us very well. As with every part of our COVID-19 response, we'll continue to focus on improving it. However, even the gold standard of contact tracing isn't always enough to keep the Delta variant at bay. We've seen that in New South Wales, where they've previously stamped out COVID-19 cases very efficiently with their contact tracing system alone, but they have not managed to achieve that this time. Sydney, Australia's largest city, is now in its 7th week of restrictions, including a stay-at-home order, which is the result of the Delta outbreak. For several days now, they have reported over 300 new cases. We in New Zealand do need to look at that and make sure we are taking the lessons that we need to take from that experience. So we're adjusting our response and our likely response to new, more infectious variants as we seek to ensure that COVID-19 does not gain a foothold here in New Zealand. So as we've done from the start, we would look to respond very quickly to any potential case of COVID-19 in the community. Yes, we would continue to use our contact tracing systems, but we would also look to escalate alert levels quickly in the event that we discovered a case of COVID-19. That means it is more likely that we would end up with a short, sharp move to COVID-19 alert level 4 for either the affected area or the whole country, depending on the circumstances, in the event that we saw a case of COVID-19 emerge. As we know from our own experience, the best economic response is also the best public health response is also the best economic response. We don't want to spend a drawn-out period of time with restrictions in place, and a short, sharp lockdown is more likely to be successful in the current context than a longer, more drawn-out, lower-level response. So my message to all New Zealanders is that this is not over, that we are still going to be dealing with COVID-19 for a while yet. Further lockdowns are possible. If they were to happen, they would happen as they did previously with very short notice. And everybody should have a plan for what they would do in those circumstances. We don't want to spend a long time in lockdowns. We don't want our health system to become overwhelmed, and we don't want COVID-19 spreading here in the New Zealand community. And so that's why we will continue to monitor vigilantly and to respond quickly should anything emerge. It's also why we continue to strengthen our border. And that's why we've decided, based on the latest public health advice, to add Indonesia and Fiji to the very high-risk country category. That means that from 11:59 p.m. New Zealand time this Sunday, the 15th of August, travel to New Zealand from Indonesia and Fiji will be restricted to New Zealand citizens, their partners and children, the parents of dependent children who are New Zealand citizens. Other travellers from very high-risk countries, including New Zealand residents, are required to spend 14 days outside of a very high-risk country before they can fly to New Zealand. The countries we announced in April, India, Brazil, Pakistan and Papua New Guinea, continue to remain in the very high-risk country category. We keep that under regular review. We put these stronger measures in place for specific countries as outbreaks there are out of control, and we want to reduce the risk to New Zealanders of people bringing COVID-19 here from those places. Travellers transiting through New Zealand from Fiji to other countries can continue to do so, but they'll be required to remain airside and spend less than 24 hours in transit in New Zealand. We've made that decision on the basis that at the moment, that if we didn't allow transit through New Zealand for people travelling from Fiji, there would basically be no way out of Fiji for anybody that's currently there. The government's continuously reviewing these border settings to ensure that COVID-19 is kept out of our country and out of our communities. Today, I can also report that expanded saliva testing, the program that we've signalled previously, is rolling out now across multiple sites. The first sites to be rolled out are at the Auckland Airport, the ports in Opua, Northport, Auckland, Prime Port in Timaru, Port Chalmers in Dunedin and Taranaki. Border workers who are on a 7-day testing cycle at these locations can begin saliva testing from today. This will be expanded over August and September to include the rest of the estimated 13,000 active border workers. It'll provide further surveillance testing at the border and an option for those who find the nasal pharyngeal swabs frequently to be quite uncomfortable. It's important that we continue to adjust and improve our border settings to deal with new variants of COVID-19 so that we don't lose the gains that we've made and the freedoms that we currently enjoy as a result of our elimination strategy. As Professor Skegg noted in his report, and I'm sure all of you have read that, we must prepare to maintain our border first before looking to open up our border.